Hey guys, my name is Brandon with Low T Nation, and you guys are watching one more of the videos in our series that we're putting out to educate men so you guys can make the right decisions when it comes to managing your health while on a testosterone replacement program. One of the most important decisions is choosing the right doctor. Obviously, besides yourself, the doctor is going to be the single most important person in making sure that this is a positive experience for you and that it's a successful experience for you, because the wrong doctor is going to be as bad for you as the right doctor will be good for you. Okay, the thing about testosterone replacement though is they don't teach doctors how to do this in med school. It's just not taught in med school, okay? So if a doctor's going to be good at it, they're going to have after school training that they've gone to, whether it's conferences or whether they signed up for additional groups that specialize in this. That's going to have to be the answer to the first question that you guys are going to ask them, and that is, what additional training have you had? They have to have had some kind of additional training, or just be the exception to the rule where they've done a lot of research on their own and they can talk about the remaining questions intelligently. But the first red flag is going to be when a doctor goes, you know, I haven't done any additional training in the area or the arena of testosterone replacement. The next question that I like to ask is, what other co-traveling agents or prescriptions or hormones or whatever, leave it open-ended so they can talk about it, but what other co-traveling agents are you going to give me once I start my testosterone? All right, the two absolute no-brainers, HCG is going to be mandatory, at least in my opinion. Every patient on testosterone should be on HCG. If your doctor doesn't say HCG, right then, move on. Your doctor should also know how to block estrogen. In case your estrogen levels climb, they have to know how to block it and also what range to keep you in. If the doctor doesn't know that he needs to keep you in that 30 or the 20 to 30 picograms per milliliter area, then you need to get another doctor right now. Because if you watch some of these other blogs, I have one on estrogen, a man's estrogen level is one of the absolute most crucial factors in determining how long he's going to live, and also how associated his risks for heart disease, cancer, prostate cancer, and diabetes are going to be. So your doctor has to understand that he has to manage your estrogen, and he has to know how to do that. And he also needs to know about Clomid in case you are a younger man thinking about family planning. That's when Clomid gets introduced, and he can't be one of these old school guys that uses Clomid with testosterone full time, because that's going to reduce your free testosterone that actually is bioavailable to your system. So just ask him that question. What are you going to use along with the testosterone? He needs to say HCG. He needs to make sure he's monitoring your estrogen levels, and he knows how to mitigate high or low estrogen in your body. And also, if you want to do family planning and you don't want a decreased sperm count, how is he going to do that? And the answer to that is Clomid. The next question I like to ask will determine if the doctor's looking at enough different things in your body in order to properly diagnose and prescribe you. So ask him, what labs are you going to run? Okay? Every doctor out there is going to say, I'm going to do a CBC, I'm going to do a CMP, we're going to look at your lipids. That's good. That's going to get just a basic glimpse of your overall health and make sure that nothing catastrophically wrong is currently going on. But he also has to be looking at hormones, free and total testosterone, obviously, because you're getting on a testosterone program. He needs to look at your luteinizing hormone and follicle stimulating hormone, because that's going to tell him if those are low, then the problem is possibly secondary hypogonadism and not primary hypogonadism. And so the way you manage HCG is going to be a little bit different between those two possibilities. And you want to make absolutely sure he's looking at your estrogen levels and your PSA, because those two, when they get out of control and get out of hand, it means something really bad is wrong, or something really bad is going to be wrong at some point in the future. So those are the blood tests at minimum, okay, that a doctor is going to look at. Now, there's a lot of other tests like DHEA, prolactin. There's a bunch of them that they can add on to this, okay, based on how sophisticated the care of that individual doctor is. But the LH and FSH, free and total testosterone, just the basics with CBC and CMP with the lipids, and also make sure they're looking at PSA and estrogen. That's the set that have to be looked at in order to accurately get a patient started in my opinion, okay? And the next question is ask them how often they're going to be running these blood tests, okay? There's some doctors that will have you in that office every 8 weeks. I've seen it so many times, and they don't need to do that, okay? They need to see you at about the 8 to 12 week mark after the first time they put you on testosterone, okay? They need to know how well it's baselining, what your estrogen is doing, like where you actually capped out based on the amount of testosterone they gave you. But after that, they don't need to see you every 2 months. And if they're doing that, they're making a lot of money on the labs and office visits that don't necessarily need to be paid by you or your insurance, if you ask me. The law says every 12 months you have to come in for blood work, okay? So the right answer, and again, now this is an opinion of mine, but the right answer is somewhere between about 4 up to 12 months. 12 months doesn't seem right for me because prostate specific antigen counts can get out of hand in a year on aggressive patients, on patients with aggressive benign prostatic hypertrophy or the initial early stages of prostate cancer. And also estrogen can spin out of control big time in 12 months, and we don't want that. Estrogen levels are crucial to maintaining health. Like, we have to keep estrogen levels in the right range in order to maintain long-term health. So 12 months is just a long time, if you ask me. So at Low T Nation, we do it every 6 months. That makes it easy on the patient, so they're not having to come in every 2 months and not having to pay out of pocket or pay insurance or pay co-pays or whatever. But also, we're seeing their blood work every 6 months. Like, we know what they look like. It's half of what the legal requirement is as far as a calendar year. So somewhere around that 4, 6, 8 month mark, to me, is what you need to be doing. And a lot of these telemedicine docs, they'll like see you every year, for a quick minute on Skype or something like that, and they'll just have you go to LabCorp. Just realize that when you're dealing with a doctor like that, that's some hands-off care, okay? If you're not getting to talk to the doctor, if you're not getting your questions answered, okay? If you feel like he has no idea what's going on with you, find a doctor that really does take the time to look at you, to talk to you, to listen to your questions, to answer them until your question is answered the right way. That's going to make all the difference in the world, okay? But frequency of blood work is important so that they can medically supervise you the right way. Another thing that's going to be important, and this isn't necessarily about the way the doctor is doing it right or wrong, but ask them about the logistics of their program and see if it's the right fit for you and your lifestyle. If you travel a lot, are you going to be able to get into the doctor if he wants to do in-house shots? If he wants you to go to a pharmacy every single week to pick something up, are you going to be able to do that? There's a lot of ways to skin this cat as far as the logistics and operations of the program. Just make sure that the operations of the doctor that you're talking to match your lifestyle. Okay, at Low T Nation, we send everything to our patients once a month in a box, and that's everything down to the alcohol swabs for the injections. We want to make it convenient for them, and because we do that, it actually makes it more cost effective, believe it or not. But we want it to be convenient because convenience equals compliance, because you're always going to have the medicine when you need it. Like when it's time to take the medicine, you have it if it was shipped to you. And then compliance equals effectiveness, because if you start missing shots, the program's not going to work as well. You're going to get frustrated. You're going to end up quitting. And a lot of that has to do with just the logistics of a program not matching, your lifestyle requirements or the way you want to actually go about having it done. So make sure that the program is going to make sense from an operations standpoint from your life, because if it doesn't, it's going to be frustrating. And I promise you, at some point, you're going to end up either walking away from it altogether or finding another doctor that has a program that kind of suits your needs better. Another question that's always a bit of a gotcha, and you can catch doctors off guard with this big time. You ask them, what level do you think I need to be at? Now, this is, the answer to this has to be coming from a doctor that doesn't know what your original levels are. If he has a baseline from you from 10 years ago, and he wants to get you back to that level, then he'll say, yeah, 10 years ago, you were feeling great, you were at a 690, we're going to get you somewhere around there. That's a smart answer, because he has something to compare it to. But if the doctor has no idea what your levels were and when you were feeling good, and he throws that number out, just an arbitrary number like 900, he goes, yeah, I get everybody to 900. Well, that's the wrong answer, because every patient has a different physiologic cap where they need to be. You know, we get a lot of guys that walk around in their prime at 1,000, and other guys walk around in their prime and they're fit, lean, cut, in great shape, and they're at, you know, 450. So getting that guy that should have been at 450 in his prime up to a 900, because that's the protocol or the number that, you know, that doctor uses, is not the most responsible thing to do, because you are doubling that guy's physiologic requirement. So just make sure when you ask the doctor, hey, what level do you think I need to be at, that they don't just throw out some arbitrary number and they're putting all their patients to that. That's a one-size-fits-all, like cookie-cutter program, and the people that need less than that obviously are getting too much, and sometimes a doctor will say something like 600, and a lot of patients need to be carried more than that. So don't let your individual requirements be dictated by his protocol's number, all right? Keep that in mind. And then the last question, and this always ends up being a very important one, is how much is this going to cost? Is it cash? Is it insurance? Make sure that you understand all the gotchas. Like when you're going to have labs run, is it going to come off of your deductible? Like, can you get it done if you haven't paid your deductible? Are you going to have to pay office visits every time you come in and see him? What's the copay going to cost? Are you going to have to pay out of pocket for HCG and anastrozole and Clomid if necessary? Those can add up so much, okay? So make sure you understand all the hidden fees. A lot of times the doctor's like, yeah, we'll take your insurance, no big deal. And then you're still dropping $300 a month on HCG and anastrozole or something like that, all right? So make sure, guys, that you understand all the hidden fees. I prefer cash-only programs because we're allowed to ship everything because we're using cash. We ship HCG, we ship our anastrozole, Clomid if necessary, all the syringes, the alcohol swabs, the testosterone, everything in one box to our patient's house. We can't do that if we're using an insurance-based model. And because we're doing so much purchasing and we have hospital buying powers, we can actually do that for a fraction of what some patients with their insurance are having to pay out of pocket. Okay, so they use their insurance, it gets the testosterone covered and it gets the office visit covered, but everything else is coming out of pocket. And normally what an insurance-based patient is paying out of pocket each month is about what we charge for the entire program. So just make sure that the doctor explains clearly what all the hidden fees are, and make sure you understand the implications of your deductible and your copays, because those really add up, especially if you're using a doctor that makes a lot of frequent office visits a part of the program. But that will let you know, again, just like the operations of the program, is this going to suit me and my budget and my lifestyle? And is it going to be worth it to me? All right, so if you guys have any questions on this, feel free to leave a comment here on YouTube down below, or hit us up at Low T Nation. There's a lot of ways to get a hold of us through the website. I look forward to hearing from you guys. Thanks for watching. Have a great one.